Thanks, guys. Oh, okay, all right. Yeah, Keisha, that looks like a great answer. Sorry I wasn't. Hi, Monica. I hope you guys are doing well. We are continuing on there to part B. And yeah, let's go. I'm recording, so. And I am. Let's go. So, here we are. Part B. We're going to do talk about a little surgery, surgical procedures, types of ORs. Interesting. Surgeon's preference card. Carts. Something as silly as, a push cart. We use them all the time there in the lab, right? And like on days there when maybe pre-health is doing, porcine heart dissection, and then you've got the microbial lab there. They're doing a microscopy lab. Everyone has got their own carts, and the lab demos, they organize their carts, and this is what I got. You wheel it there to the lab. You set up your microscopes, and at the end of it all, after students have handed in their stuff, you get your microscopes, put them back on the cart, and it goes back into the storage area. Carts are very important. It's a major, major source of issues within a hospital setting. Carts mislabeled, carts not having the right equipment on there, different carts, you know what I mean? You don't want, a wart removal cart when you're doing open heart surgery. And one of the things that we're going to show you is the amount of people that are involved in this. And again, this is all procedure, policy. It's all this stuff is written down. It's been documented. It needs to happen. It needs to. If you guys are working in a hospital setting, you have to know this stuff. And just like what I said there before, probably more importantly, you have to know when the law has been broken, when the sterile field has been breached, if there's a possibility of infection or contamination. So you got to know both sides of the coin, man, I tell you. You got to know how to keep things clean, and you got to be able to recognize when something is contaminated. Okay? And then the last slide there, emergency codes. You got to know them. But again, for a testing situation, you don't have to know anything. You just have to be able to have your PowerPoints up and know how to find it. Okay? I want to show you guys this here. I don't know why that's not popping up. Internet's sketchy there today. I don't know why. Yeah, the this link here, just if you guys want to know about any surgical procedure, I haven't gone through all of these, but EEG, electroencephalogram, ECG, electrocardiogram, and all of the, why do I need an ECG? What is an ECG? And I haven't gone through all of these, so I can't, confirm the validity, but these look really, really good. All these different kinds of surgical procedures. Now, again, am I going to come after you for all these? No. Okay? But knowledge is power. Okay? Gastroscopy. We're going to talk about endoscopy there today. They putting a camera down your throat. And you can put cameras wherever you want now. Cameras are pretty small, and you'll see that there later when we get into a bit of urology. Laparoscopic. That's a word there that we're going to cover there today. Okay? And all these different kinds, there's all these surgeries here. So, I don't know. In theory, on a tests, maybe I could, anything, look up a PET scan, a CAT scan. Keep this little link here for this PowerPoint handy. Keep it close. You may need it for a testing situation. And but again, am I going to go after, amazingly intricate details of any of these? No. Okay. So there's a little surgical link there. And for your own, if you're thinking about some type of surgery, of elective surgery, cosmetic surgery, any type of surgery, there's risk. Okay? Once you break that skin, you have no idea what can get in. All right? So if there is a choice to do surgery or not do surgery, obviously the choice is to not do, but we do surgeries mainly because we have to, but not always. We'll get there. What is surgery? Surgery is a procedure in which incisions and physical manipulation are used to treat a patient with an injury or a disease. The patient's tissue are cut during this technique to permit the manipulation of tissues that are otherwise inaccessible. You can't get to the heart until you cut the skin, right? These various types of surgeries, there are many kinds of surgeries, and we're going to talk about a few of them here. And they can be classified in a number of different ways. The type of equipment used, robotic surgery. Okay, we can talk about the orthopedic surgery, bones, hard tissue. Okay, we'll get into all these. Equipment used, the purpose of the surgery. We'll show you guys all these here. Elective surgery. And the name elective might imply that this type of surgery is optional, but it's not always the case. So we say elective surgery, you have a choice. Well, it's no. Elective surgery, like for cosmetic surgery, these kinds of things, yeah, you do have 100% choice. You're not going to die if you don't get that rhinoplasty. You're going to make it. You're going to live to be 99 with that nose. All right? But if you choose to get the rhinoplasty done, if you choose to get the nose done, okay, you're involving yourself in the risk. And any type of plastic surgeon, they always have a signature there at the end that I know my rights and this is elective surgery, and if I go down, don't sue me. An elective procedure is simply one that is planned in advance. So if you thought that elective surgery only meant that it was optional, like cosmetic, no. An elective procedure is simply one that is planned in advance rather than one that is done in an emergency situation right now. Okay? So if you're having foot surgery there in February, okay, that's elective surgery. Even if you have to get it done or don't have to get it done. Okay? Elective surgery means that's something there that we can plan. It doesn't have to be done today. So maybe it's needed, maybe it's necessary, okay, but it doesn't have to be done there today. Semi-elective surgery, okay, so this is based on time. Okay, there's a couple different categories here. You'll see there that I've got red boxes down here, okay, and these are kind of the categories there that I'm kind of get you guys. So this one here has to do with time. So elective surgery, this surgery can be done at a later date. Okay, it still may be life-threatening eventually, but as long as, it's scheduled there in the future, that's what we call elective surgery. We've got semi-elective. Okay, this is surgery that must be done to preserve the patient's life, but doesn't need to be performed there today. So semi-elective surgery, you need to get it done, but it doesn't have to be today. Urgent is one that can wait until the patient is medically stable, but should generally be done today or tomorrow. So, you look at, I don't know, I'm just going to take this example, like a gunshot victim, okay? And there are maybe, the first thing you do is you get the blood back in the body because you're probably looking at a lot of lost blood. You stabilize the person, okay, to some level of stability, okay? You're not going to do surgery on somebody who is not stable. If they're in the middle of cardiac arrest, well, you're going to fix that cardiac arrest first, get them into a stable, and we want to monitor their stability over a 12-hour period. Are they going to live, for 12 hours? And that's what we're looking at there. Emergency situation, and this is the one there where it's now or never. Okay? It's now or never. So there's surgery based on time. You can have surgeries based on body parts. Orthopedic surgery. Okay? Ortho, here we're talking bone, muscle. Okay? The medical specialty dedicated to the diagnosis, treatment, rehabilitation, and prevention of injuries of the musculoskeletal system. Okay? Bones, muscles, spine, joints, ligaments, tendons, nerves, these kinds of things. There are other ones there. General surgery. Okay? Gynecological. Okay, for reproductive systems there. Cardiothoracic. Cardio. Heart. Thoracic. Chest. Okay, like even you look at an insect, they have the middle section there is called a thorax. Okay, and vascular, this is vein, venous. Like we're going to talk about, and this is where I'm going now. We're going to start. Am I going to whack you guys there today on anatomy physiology? No. Okay, but this is where we're going. And I think week 10 there we do anatomy physiology, but you can see where I'm going. I always like to foreshadow what I'm teaching this. If I'm teaching something next week, I try and integrate a little bit into the previous week. So I'm just warming you guys up. So that's where we're going here. Okay. Surgeries can be based on invasiveness. How much are you going to cut me open? Okay. Open surgery, because you're going to be open. And they need to open you up there so the doctor, the surgeon, can visually see. Okay. Examples of open surgery are the removal of organs, such as gallbladder, kidney, these kinds of things, right? Okay. Minimally invasive. And you'll see here, there's some, I put some definitions here that wouldn't be in your PowerPoint slide, but I'll update the PowerPoint there. We've got minimal invasive surgery is a technique involved that doesn't require a big, large incision. Okay. And this relatively new approach there allows the patients there to recuperate a lot faster with a lot less pain. And you see, I call it the knitting needle. This is laparoscopy, and where they just make these little tiny incisions, and then they've got I call them knitting needles. You can call them whatever you want there, and these scopes there that you move around. And the doctor's going like this, and you see that's the big thing is if your surgical holes are only this big, then your surgical repercussions, because any type of surgery, A, is dangerous, it hurts you, there's a recovery time required. So the bigger the opening, the bigger the recovery time. So not all conditions are suitable for a minimally invasive surgery, but many surgery techniques there, and laparoscopy, endoscopy, arthroscopy, and many others. So laparoscopy there, I call these there the knitting needles. Okay, where they just make a little tiny incision, and the doctor's using these needles to manipulate things underneath the skin. Okay, it's all about sterile, right? Endoscopy, camera. Okay, they can go down and have a look at your tummy from the inside, even your lungs there. They'll send a camera down and see what's going on. Arthroscopy, this has to do with joints. Okay, so just some words there. Surgery is based on purpose. Okay, and I think I've got, just to make sure there, that there is a list. Where's my list? Where is my list? Okay, so I think it's down further. Sorry. The exploratory surgery. Okay, this is surgery there that we're just looking to find out what's going on, because we don't know what's going on. Sometimes cancer. Okay, it's a diagnostic method used by doctors when trying to diagnose an illness. Okay, locating cancer, diagnosing it, these kinds of things. You're just on an exploration, and you're looking for something bad. Okay, therapeutic surgery. Okay, these are surgeries there that treat a previous diagnosed condition. Okay, cosmetic surgery. This is where a person chooses to have an operation or an invasive medical procedure to change their physical appearance. Okay, plastic surgery here. There are many different types of surgeries. Timing based on body parts, equipment, purpose. I've got reconstructive surgery. Surgeries there to restore the function to a traumatized or malfunctioning tissue. Okay, or to improve self-concept. Scar revision, plastic surgery, internal fixation of a fractured breast scar, where you're rebuilding something. Okay, maybe the nose. Okay, even rhinoplasty, right? They maybe you have a misshapen nose or something like that. What they'll do is they'll break it, and then they'll reconstruct it. They'll rebuild it, shave some bone off here or this or that, and that's what they do. Watch Dr. Pimple Popper. It's all there. Okay. Actually, there's another good one there. Another good TV show called Dr. Mercy. Oh, she's awesome. And I love it. We get the kids watching it there. It can be a little gross. Don't have dinner while watching them. Transplant. Here's another kind of surgery. Okay. And am I naming all the kinds of surgery? No. Have a look at that website there, that link there we just showed you guys, and there's a whole whack of them there. So, surgeries there to replace organs or structures that are diseased. Okay, kidney transplant, liver transplant, heart transplant, these kinds of things. And that's a whole nother ball, and a whole nother set of worms there. We have to take immunocompromising or immunosuppressing drugs, because you bring in somebody else's liver. Okay, your body's going to sense it, right? And go, whoa, this is not me. So, and the body will try and attack it. So, yeah, it's a tough one there. Anyone has a transplant, they have to take drugs for the rest of their life. Robotic surgery. And I'm not going too heavy into this, but it's interesting to know surgeries can also be classified based on the surgical equipment used for the procedure. And there's two here. There's Da Vinci and Zeus. And I put a link in here, and I'm not going to go too crazy on it, but I just thought I'd show it to you guys there anyway. The whole idea there that we can do surgery there with robots, okay? And because robots have the ability to be more precise than us, okay? And I mean down to the millionth of a second, thousandths of a second, and we just can't even compare. And yeah, you have a read of this. I'm not going to go too crazy on it, but just the whole idea of robotic-assisted surgery. It's here. It's not in the future. It's here now. Okay? And you guys can have a look at this there. Yeah, they talk about Da Vinci here. And more of a gynecological aspect here. Endometriosis, these kinds of things. But have a look at it. Interesting. Knowledge is power. Now, and because I moved this over here, I can't see that. There we go. Good. Yeah, microsurgery. Okay, microsurgeries there, they involve the use of an operating for a microscope. The most obvious developments have been procedures there developed to allow for anastomosis there. And what this is, anastomosis, is you have a tube. Like, think of your small intestine, right? Your esophagus. Your entire digestive tract, from mouth to anus, okay, is basically a tube. When you think about it, your esophagus is a tube. Your stomach is a tube. It has the pyloric sphincter at the top, and pyloric sphincter at the bottom. It has your cardiac sphincter at the top. It's a tube, which then leads into your small intestine, which is another tube, which then leads to your large intestine, which is another tube. Okay, so whenever you're dealing with a tube structure, like a lumen, that's the hole, right? And let's say you have cancer of the bowel and you need a section of your intestine removed, right? So you take out that diseased section. So now there's kind of the end of one of the intestine here and the end is here. Put it together. Okay? That's what we call anastomosis. Okay? The reconnecting of the tube. You've taken a section out and you put it together. Replantation. Okay? And here we're talking about like small stuff. Like you see here, the most obvious developments have been procedures developed to allow for anastomosis of successively smaller blood vessels and nerves. So here we're talking about really, really small stuff. Okay? And like for replantation, you're reconnecting the same limb. So maybe somebody lost a finger in a chainsaw accident. Okay? And they were smart about it. They stopped the blood loss there. Okay? You gathered the appendage there that you lost. Make sure that appendage is on ice. Okay? Put it in a bag, a bucket, that kind of thing. Get to the hospital. They'll put that thing right on. Replantation. Okay? But there are little connectors that need to be connected at a microscopic level. This is where we need something called a microsurgery. Okay? Where we utilize a microscope involved in the surgical process. Another one there, transplantation. So connecting a new limb or a new appendage from somewhere else. Okay? Yeah, have a look at these. Not too bad at all. There is laser surgery, and you know what I mean. I can go on and on and on and on. Laser surgery. You guys have, I'm sure you guys have heard of Lasix. This is just the whole idea of using lasers. When you're nearsighted or farsighted, okay. Like if you're nearsighted, you have trouble there seeing close by. If you're farsighted, you have trouble seeing far. And it all has to do with the lens in your eye. Okay, that's why people who have diminished vision, they wear glasses or contact lenses because you need a lens to focus the light. You'll need a convex lens or a concave lens, however that all works. All right, and what laser surgery does, and this word right here, photoreflective keratectomy. And what this is it laser. Like I thought about having it done, and yeah, you just they hold your eye open. You're on a surgical table, and they take a laser right to your eye. And what they're doing is they're altering the shape of your eye so that when the light comes in, okay, the light comes into your eye and it goes to the back, okay, where the nerves carrying the signal there to the brain. Okay, and if that light doesn't hit that nerve, then you're not getting the message. You can't see, right? You're like, oh, okay. And if you can change the shape of the eye so that when the light comes in, it now hits directly the back of that nerve, now that's where you have good vision, right? So there's laser surgery there. Not too crazy, okay? We're on the tail end now. And these are the procedures. We're going to go a little deeper into the OR and different kinds of ORs. Elective outpatient surgery, day surgery. Okay. We're going to look at the catheter lab. Catheter there has to do with urology. Okay, urethra. Okay. So you're talking the bladder, the kidneys, the ureter. Okay, peeing, these kinds of things. Special procedure room, intervention room, cystoscopy, endoscopy, birthing unit. Okay. And again, we're just kind of quickly going over these. Okay. Operating room is a sterile, organized environment for general use, cardiac, orthopedic, nerve, spine, urology, thoracic. So this is a pretty good looking OR, but do all ORs look like this? No. Okay. It all depends on the purpose of the OR. Is it dermatological? Is it pediatric? If this was pediatric, there'd probably be what's his name there? Bob SquarePants, SpongeBob SquarePants pictures, these kinds of things, right? For kids and these kinds of things, right? A playroom, I don't know. Members of the surgical team work hard to ensure the safety and care of their patients. The surgical team is in charge of the OR and makes decisions regarding patient care procedures. So it's a surgical team that dictates what goes on. The operating room environment has sterile and non-sterile areas, as well as sterile and non-sterile personnel. Interesting. So within an OR, there are sterile areas and non-sterile. and there are people who are considered sterile, and there are people who are not. And they're all needed. And you'll see. You must know who, what, and where is sterile at all times. That's part of your responsibility there. Okay? Just things to consider. Sterile personnel here. We've got surgeon. We consider them sterile. Surgical assistants. We consider them sterile. And scrub nurse. We consider them sterile. Non-sterile people. Anesthesiologist. Circulating nurse. Circulating means just moving around, right? They're going from here to here to here to here. Of course, they're going to be considered non-sterile. Technologist, student, observer, that kind of a thing. So, and you see that all of these things have been taken into context. Okay, a surgery, a hospital, there's going to be people around. And you're going to be performing a surgery. You might need the assistance of non-sterile people. It's good to have them around because they can go get you things. Okay? Just the whole idea here that these OR rooms, and I don't know if we can zoom in a bit here, and you'll see here, there are all these different surgeries coming in here. Okay? And you know what I mean? I'm not interested in, right knee surgery, maybe an the knee needs to be scraped there of arthritis, and then we've got Mrs. Jones coming in there for eye surgery there in the afternoon. These things are booked. And I mean booked. You know, it's a moneymaker. Got to make money. Okay? And you'll see there that they are in continual use. Now, the reason why I showed you this there is, yes, you have the doctors booking the rooms, you have the nurses involved in the equipment, but then you also have the people, the MDR people, the medical device reprocessing people, who take the equipment out after each surgery and take it somewhere, clean it. They got to bring it back. Who's doing this? How are you doing it? You're using carts. You've got sheets. You've got work orders. Okay? You've got all these things. So that, like, in a hospital environment, don't ever think that you're by yourself, because it just doesn't work like that. You've got 10 different people all facilitating. If this cart is in your surgery and this cart is the right cart and you've got all your stuff on this cart and you just did a successful surgery, there was probably 30 people behind you who actually helped you and assisted you to get to that point. Okay? And that's one of the things there I want to stress, is that you've got sterile personnel and non-sterile personnel working together. Okay? I threw this in here. This isn't anything too crazy. And I started it here. You could start anywhere. This is the whole surgery process. And I just said start here. So here is your surgery. Your surgery just happened. You had, a knee replacement. Woo! Okay? So all the used equipment, okay, is sent from the OR to CS, which is the central service. Okay? And that's your medical device reprocessing right there, all right? So all the instruments have been removed from the surgical room, the OR, okay? Now they're decontaminated and washed, okay? And just because something's clean, actually, if something's clean doesn't mean that it's sterile, right? And that's where we're at. So you're going to get all this, get all this stuff there together. Now you're going to sterilize it, get it all ready to go. And then it's inventoried and repackaged and stored in a sterile place. Okay? And in the meantime, the OR sends a request because there's going to be another surgery next Tuesday. Mrs. Simpson's coming in there for her other foot. So we need to tell central services there that, hey, we need 4 scalpels, we need this, we need a spatula, we need a frying pan, we need all these kinds of things. Okay, so the OR patient case request is made to the CS, and the patient case and everything is organized. Okay, they need one of these, they need one of these, and see all of these different things, they get put onto a cart. And this cart is for Dr. Smith, Thursday, 2 o'clock, OR room 314. Okay, and this one here is kept in a sterile environment until it's ready to be moved to that surgical room, the OR. Now, that cart can't go to the OR 2 hours before surgery because there's another surgery going on in there. So, in all of these things, they have to be noticed, adhered to, okay? You know what I mean? There's so many things going on. And you have a look here at the next picture. Oh, yeah. This is exactly what's going on. And you see all these tags? They all have details, right? Excellent. Excellent. Day surgeries there. These are surgeries there that can be done in, you're actually waiting in the hallway longer than your surgery. Okay. Some of these are pretty bad there. All right. But these ones here are day surgeries. There's no need to stay overnight. Okay. Come in, you don't eat any breakfast. Usually a rough day because you're not allowed to eat any breakfast or have anything to drink, really, because they don't like having food in your stomach when you get any type of anesthesia. Okay. What have we got here? Interventional radiology, also called IR. Doctors use medical imaging to guide minimally invasive surgical procedures that diagnose, treat, and cure many kinds of conditions. We got deep vein thrombosis, and these are blood clots. Oh man, like if anyone has taken long air flights, like I've taken, I think my longest was it 14 hours from here to Seoul, South Korea, and stopped off in Chicago. I think it was a really long flight, but they tell you to do not sit down for any longer than an hour or two. You need to get up and get moving. And you don't have to do any type of exercise, but you just have to keep moving because if you're sitting down for too long, that's how you get what's called deep vein thrombosis, which are blood clots. And if you get a blood clot in the lungs, it's called a pulmonary embolism. You usually don't make it. It's a bad one. Okay. Arterial disease there, vascular malformations, veins. Yeah, just have a look at these there, okay? These are what we call minimally invasive surgical procedures. The cath lab there, a catheter is a tube that is inserted into the urethra, okay, for a number of different reasons there when we're talking about urological disease or pathology, okay? A catheterization laboratory, commonly referred to as a cath lab, because I just completely mispronounced that. Catheterization. My tongue just kind of went over it there. This is an examination room in a hospital or clinic. We're talking about diagnostic imaging equipment for arteries of the heart, chambers of the heart, all these kinds of things. That's what we're talking about there. Good stuff. We've got here balloon angioplasty. Okay. And I wanted you guys to see here the difference there between, here we've got, it's really interesting here when you're talking about like veins, arteries. These are muscle. They're smooth muscle. Okay. You don't have any control over your smooth muscle, like your stomach, all these kinds of things. But like your esophagus, as soon as you swallow that food, okay, your esophagus, which is the smooth muscle tissue, okay, and through peristalsis, okay, it pushes that food down. You don't have any control over that. That's smooth muscle, all right? It's not skeletal muscle like we have control over with our biceps and all these kinds of things, okay? And but you'll see there that through smoking, cardiovascular disease, all these kinds of things, your veins, your arteries there, especially smoking is notorious for this. It attacks the arteries, and arteries coming out of the heart, like the oxygenated blood comes out of the heart, the left ventricle, and out your you got your vena cava on the one side, your aorta on the left here, okay, and massive amounts of pressure. Arteries carry oxygenated blood. Veins carry deoxygenated blood. Now, the blood coming out of the heart, the aorta, is a massive artery. It's about this big, and I'll show you guys all these kinds of things. And the heart, it's pumping, okay, all the time, 24 hours a day, 7 days a week, 365 days a year, and it's massive amounts of pressure. Like, honestly, if you do this, do it 1,000 times. You can't, because your hand would fall off. It just, and this is your heart, it's able to handle it. But when you smoke, what happens here now is the artery starts to get flimsy. It kind of turns into, I don't know, for lack of a better word, like a balloon, a deflated balloon. Doesn't look healthy. Arteries have lots of elasticity. They're tough. But if you smoke for a long time, these arteries there, they become flimsy and weak, okay? And what they can do now is they can use a balloon angioplasty here when we're talking about the heart. Yeah, see, they put a deflated balloon in there, and then they blow it up. And you see now, you've got that artery back into, a usable form. Now blood can flow. There's also something called stents. Okay, they use those. Anyone there? These are becoming quite popular here. They just slide these right up in the artery and keeps it open, so blood can flow through. Right? Thrombectomy there, blood clot removal. So just have a look at these there. There's some good words there. Yeah, fun stuff. Cystoscopy procedure room here. So cytourethroskopy. Here we're talking about urethro here. Cystoscopy is a procedure that lets a urologist view the inside of the bladder, okay, and the details there inside. How is it performed? Most often done as an outpatient procedure. Before the procedure, you empty your bladder. You'll be placed on an exam table. A liquid or gel local anesthetic may be used on your urethra. Okay, it's just kind of a topical there to numb the pain. Okay, it takes about 5 or 10 minutes. And you'll see here a cystoscope is inserted into the urethra and goes all the way up to the bladder. Okay, and you're just checking there for infections here. Okay, you've got male, female examples here, and it's just a way to see if there's any infections, what's going on. If we need a visual representation, we take some samples or whatever, okay? Because what they can do is they can scrape the inside there of the bladder wall to see what's going on, if there's any type of malformed cells, these kinds of things, okay? That's called the cystoscopy. Endoscopy here, okay? You can have one there for the rectum or for the esophageal area into the stomach there. Even there in the lungs as well. Just visual little camera there, just to go and see what's going on. There for the large intestine there, they check for polyps. Okay, these kinds of things. HPV, you want to be careful of. That's a bad one. If you haven't had your vaccination there for HPV, you should look into it. Any issues on that, let me know. The birthing unit. And instead of just going through all, you know what I mean, we can all, have an idea of what goes on there in the birthing unit. But, like, if you wanted to recreate the birthing unit in your house and be safe as the birthing unit in a hospital, man, you'd need a lot of equipment. And this is what I just found this website here, okay, and it just talks about all the equipment that you need in a labor room. Okay, birthing bed, delivery table, okay, vacuum apparatus, suction apparatus, right? Because you want to get that mouth of the baby clean, ready to go. You don't want any mucus in there. We want breathing, breathing, breathing. We want baby breathing. Lights, anesthesia machine if need be, fetal monitor. You know what I mean? And the list goes on. And so these are just some of the things that are involved in a birthing unit, okay? And it just keeps going on and on and on. And yeah, have a look at those. And that's what we're looking at there. Now, again, I can't see this right here. Hey, get back there. What's going on? So here we are now. We're almost at the tail end there. I think we only have about 4 or 5 slides to go. So you guys will be free of me soon. This is one there, maybe you didn't know, but a surgeon's preference card. And it's just like the whole thing that the surgeon is the person there performing the surgery. So they basically have somebody's life in their hands. So whatever they want, they get. If they want chocolate ice cream for lunch tomorrow, we give them chocolate ice cream for lunch tomorrow because they're the surgeon. We only want happy surgeons. We don't want unhappy surgeons. Okay? And all these are, and every hospital, it'll be different. But let me see if I can just kind of blow this up a bit here so that you guys can see. You really can't see, can you? Yeah. The surgeon's name, procedure to be done. Here's an appendectomy. Okay, how do you want the patient? Okay, do you want them on their back, on their side, on their head, standing up? You know what I mean? That's silly as it is, it's crazy important. Glove size. Okay, and you see they fill these cards out and they go to somebody, and somebody makes sure that all of these things are ready to go for Thursday at 2 o'clock in M315. Okay, because this is what the surgeon wants. Okay, and so preference cards are forms filled out by all attending surgeons indicating what specific tools, supplies, correct room setup they require for a single one surgical case. So one of these details one surgery. One of these is never for 2 or 3 because you could just imagine the nightmare that could lead. Okay? Ensures accountability that when the surgeon begins performing surgery, they have everything they need to operate, correct room, accessibility, sterility, okay, sterile nature, make sure everything is ready to go. If it's incorrectly filled out, then this can cause delays in daily scheduling, increasing wait time, surgical costs, because if the surgery at 8 o'clock in the morning has been delayed by 45 minutes, you guys saw the operating room schedule there. There's no time in between. So if the first one is delayed, then all of them will be delayed. And maybe that's the reason why it takes 8 months to get a surgery here in Canada. I don't know. Things that make you go, included in this, anesthesia. Is it required? Is it not? What kind of anesthesia? Where? Okay. Latex gloves, size, needed equipment for supplies, sutures, stitches, dressings, gauzes, band-aids, tape, and equipment there to stabilize the patient for positioning. Do you want them on their side? That kind of a thing. We've kind of talked about the case cards here. I just wanted to show these to you here that they are mucho bueno importante. They are ridiculously important, and it's just something there that we don't think about as, as important. But this is a major mode of error in a hospital situation, okay? And you'll see they all, like hospitals will have thousands, well, shouldn't say thousands, let's say hundreds, maybe 1,000 in a hospital. You know what? Probably more. And they all look the same. So how do you know which? Like, let's say you walk in and it's Sunday night, 11 o'clock. And Sunday night, 7 o'clock. You're just coming in for the midnight shift, 12 hours. You're working Sunday, 7 at night till 7 in the morning. And you've got these carts there to give out because you've got open heart surgery there. You've got and you see how crazy important this is? And all these carts look the same. Which one has got to go to which room? When has it got to be there? Oh yeah, man, there's no fooling around because people's lives are on the line. Errors in cart picking up. You guys can have a look at these. We've kind of talked about these, okay? Wrong case picked up, incomplete case, wrong surgery time. The list goes on, okay? More errors here. That's how important it is. It made it into the PowerPoint. because doing some reading there, and this is a major source of HAI, hospital-acquired infections. Okay. And hospital emergency codes. You can have a look here. We've got blue indicates cardiac arrest, pink neonatal, pediatrics. Okay. Pediatrics means kids. Okay. Obstetrician. Okay. Surgical emergency. Here we've got red is fire, understandably. Green, evacuation. Orange is external. Disaster. White is a violent situation. Okay. Bomb threats, missing patients. And like on a quiz or testing situation, I'm going to, well, what does a yellow hospital emergency code indicate? Well, you don't have to memorize it. You know, if you're in a hospital, you should memorize it, but you just need to refer back to this slide and answer the correct question. So that's where we're at. That is it. A bit of a long one there today, and I hope you guys are doing all right. Do you guys have any questions for me? If you do not, you are free to go. But yeah, thank you guys. I appreciate your time. Again, I don't anticipate any issues, but just a reminder there that there is no quiz next week. Next week is quiz 9. It's just a normal week. The quiz will open after week 10. Okay. And then week 11 there will be test 2. So quiz 2 is week 10. Test 2 is week 11. If there's any issues with that, you guys just let me know. But other than that, get out of here and enjoy your week. Okay, I'm going to stop recording. And away we go.